Integrated approach of yoga therapy for stress-related health problems. Modern science has shown enormous growth and improvement in the last century. Ever since the Industrial Revolution, man has achieved, is still achieving great heights in the field of science and technology. We have better living comforts. We have progressed from buses and trains to car, to air, to space, and the field of information technology is booming. As a result, the world is shrinking and we are all moving towards a global family. But the pollution and stress levels are still on the increase. Stress-related ailments have increased. Modern medical facilities, advances have helped man come out of this pain and suffering with many wonder drugs, fascinating ICUs, increase in success rate of surgeries, etc., etc. But have we hit the nail on its head? Let's listen to what experts have got to say.
As a medical consultant specialist practicing in US for the last 20 years, I can say that modern science does recognize that current stressful lifestyle does play a significant role in the cause of many diseases. This is true for major killers like cancer and heart attack, as well as for slow killers like asthma, blood pressure, diabetes, anxiety and drug addictions, etc.
Stress is not just the effect of the outside, but stress is, according to Indian philosophy, a deep-rooted imbalance which percolates into various personality levels.
According to yoga, the term mind has been designated as chitta, and the term for that is called manas. We can say that one thought is one unit of mind, and therefore mind is a collection of thoughts, conglomeration of thoughts generally. And yoga is to gain mastery over these thoughts.
The problem of life is due to self-ignorance, not knowing the Ananda nature of the Atma, and once one knows the Ananda nature of the Atma clearly, the imbalance of the emotional life is going to go away. The complete health really starts from spiritual life. Spiritual life is also inherent, it is not to be achieved, but it is to be understood, and the understanding can happen with the help of Shravana, Manana, Nididhyasana. Then Shastra says, Tatra ko mohaha kah shokaha ekatvam anupashyatah. Once a person sees the oneness everywhere, there is no question of shoka, misery or moha, infatuation.
Science has clearly established today that the stresses, which are nothing but the intense, uncontrollable emotions at the mind level, starts working on the brain, stimulates the brain, excessively speeded up activity which percolates into the entire system and brings about a terrible imbalance and makes every organ work in a haywire way, and that if becomes long standing and repeated and had become a habit, results in illnesses. The factor is, although in many of these ailments the problem is at the psychological level, stress level, speeded up mental emotional state, it is the family tendency or the genetic tendency or maybe an injured organ that decides where the problem settles down. It may be in the stomach or the heart or the joints, depends on the family tendency.
The sages have given various techniques at different personality levels, particularly like yogasanas, kriyas and several other techniques at the physical level, pranayama at the level of prana, meditation techniques of various kinds at the mental level, and jnana yoga bhakti yoga at intellectual and emotional level, so that one can really remove all the disturbances at the deep rooted personality. This is what is the advantage that we get in the yoga therapy when we try to give this holistic or integrated approach of yoga for the people.
Let us see how the integrated approach of yoga therapy is incorporated in the daily routine of the therapy participants at the beautiful campus of Prashanti. The day begins with Pratha Smarana, morning prayer. Then they proceed for special techniques, yogasanas. Gita chanting in Maitri Milan. Doctors and instructors meet the participants daily. Time for pranayama. Simple, vegetarian, sattvic food at Annapurna. Enlightening lectures. Yogic counseling.
Lot of listening is being done so that I will come to know where the stresses are coming for the patient. So, how to get rid of those stresses by yogic counseling? I will use many yogic techniques to release the stresses.
Om meditation.
I have been suffering from familiar cerebellar ataxia. I was so depressed. After doing yoga, I feel confident. Now I can able to serve in the library.
Yoga does play a role in certain psychiatric conditions like anxiety neurosis, phobia, depression, and also obsessive compulsive disorders.
I was suffering from dizziness and this breathlessness, chest pain and mental anxiety and all that, and depending on so many medicines. Coming over here, those medicines have been deleted within 1 week or so.
Due to hectic lifestyle of mental and physical strain, I have been suffering from severe back pain. My MRI report shows a disc prolapse in lumbar 5 region. After taking 55 days of bed rest, even the slightest movement in the bed, I was experiencing severe pain, and hence it was decided I should go for a surgery. I am here with Prashant Kutir for since 20 days. And I have got a tremendous change in me. I have been able to walk around and sit for a few minutes.
Sarve vyadhayah adhijaha yeva. All diseases are born of a disturbed state of the mind. He generalizes the statement as far as this one. He includes every sickness, or he brings every sickness under the condition of a disturbed mind. And once the disturbed mind or the disturbance of the mind is corrected, the diseases automatically go, is the position in Yoga Shastra.
Panchadashat varshat purvam mama asti dantaha sthanapalataha jataha asit tada bahu vedana asit ग्रीवभागे वेदना भुजभागे वेदना मुखमुद्घाटितुम् अपि कर्तुं न शक्यते स्म एकवर्षपर्यन्तं बहु क्लेशेन अनुभूतवती तद् केवल दिनत्रये एव गतम्
I was terribly depressed. Last year I had a shock of my life and I was about to end my life. After taking so many anti-depression medicines, it didn't work on me. So I came here
and I think I found a lot of improvement in me. I got a lot of confidence.
Yoga is not free from side effects. There are people who practice complicated asanas and sometimes can end up with back pain and overstrain of the joints, etc. In fact, there are special techniques of yoga for overcoming this type of problems also. The other major thing is, if people do intense spiritual and yogic practices, particularly kumbhaka pranayama, etc., they can end up with lot of mental imbalances. This is because of extremely heightened focusing or concentration, and the scriptures do recognize this problem and they offer solutions to this, and we have had many people who benefit by defocusing practices, etc., which involve body level working, breathing level working, etc.
Do we have documental evidence to prove all this? Yes, we do. Our first research paper was published in the British Medical Journal on August 25th, 1985 on yoga for bronchial asthma. 25 years of research on yoga therapy has proven the efficacy of yoga in the management of various diseases. Let us now listen to the in-depth views of the experts on the role of yoga in prevention and management of stress-related health problems.
Yoga for digestive disorders. Problems of the digestive system are becoming more and more common in the modern era. The stress is the main culprit, which is the cause for acid peptic disease and irritable bowel syndrome. Where does yoga work? How does yoga work? Let us learn from Dr. Nagaratna.
The two common conditions, the acid peptic disease and irritable bowel syndrome, are becoming very common in the present day living style, and it has been traced to modern age lifestyle. Let us understand a little about this particular condition. The acid peptic disease, which used to be commonly known as peptic ulcer, can happen in the duodenum when it is called duodenal ulcer, which occurs in slightly younger people between the ages of 20 and 40. It is much more common in India and USA, whereas if an ulcer occurs in the stomach lining, it is more common in Japan, and it occurs in slightly elderly age group above the age of 40 years, characterized by abdominal pain, burning, discomfort, gas, distension, etc., with characteristic clockwise 3 a.m. hunger pain. They are woken up early in the morning, and this is a common experience of many people with hyperacidity, and generally it is a pain that occurs about 3 to 4 hours after eating. This peptic ulcer or acid peptic disease, what exactly is happening inside the stomach is that there is a fighting, an inflammation going on in the stomach, and this is due to the acid peptic digestion, we say. What is this stomach? What does it do? The stomach is the first elastic bag into which we gulp in everything that we want to eat. You know, if you are a hurry person going around, walking around and not having enough time to eat, you would simply gulp everything, and God has given us a big elastic stretchable bag into which you can go on loading and loading and loading. Luckily, we do not have 4 bags like mammals, and this elastic bag is a place where the digestion also begins. The protein digestion begins for the first time here, and this also has a very strong acid which is probably meant to destroy any toxin or germs that may enter, because that is the first portal of entry for anything that we go on eating. What is this protein in the food? The food like nuts, dals, pulses, non-vegetarian food, the meat, etc., that we eat is the one which starts getting digested in the stomach in the presence of a very strong concentrated hydrochloric acid. In fact, if you take a drop of the acid and put on your own skin, it may start burning, and this acid plus pepsin starts dissolving this protein that is contained in the meat, etc.
See, if this enzyme has the capacity to digest the protein or the meat, as you said, stomach itself is a bag of meat. So, don't you think it will auto digest the whole stomach?
Exactly. In fact, this is a very, very important question that we have to understand, that in fact, it is really fascinating to see how the stomach is protected from self digestion. There are what are called as mucus coaters, which is dissolved in the gastric juice as well as forming a nice slimy coating on the surface, which is an active alkaline medium through which, if the acid tries to penetrate through and tries to touch the wall of the stomach, it is neutralized. And there is also a bicarbonate layer, the alkaline layer, and a very healthy blood flow to the lining of the stomach, and the repair of the cells. In fact, in case some acid reaches the lining and digests the lining, that gets repaired very quickly. Within 4 to 5 days, these cells get repaired, and this rapid cell turnover is an important protector for the stomach. But at the same time, there are also aggressors, as we call it, in our food and our lifestyle, which can cause irritation and cause a tendency for the self digestion, and this is very high acid level in the stomach or increased pepsin production, and smoking, a very, very important factor in the causation of the gastric problems and the acid problems. Chilies, alcohol, painkiller tablets are all contributing factors, and if there is an imbalance between the protectors and aggressors, naturally it leads to the inflammation. The lining of the stomach starts getting little eaten away, and because it is not healing up fast, it goes on spreading and spreading and goes deeper and deeper and deeper, and if you put in a tube through the esophagus and look into the stomach, it will be seen as an actual ulcer that is formed in the stomach, and this can go into major complications if left alone.
Could you tell us why man develops this problem at all?
In fact, lot of work has gone on where there is a strong family history that has been found in people who have blood group O are prone to this acid peptic disease or peptic ulcers, and this tendency which I have inherited can get triggered off by stress. Stress is one of the very well known characteristic thing that can trigger off this attack, and the typical statement that we say that I have to go on swallowing and swallowing all the insults, frustrations and the angers of my fellow beings. I am an assistant in an office, boss is very irritable and I just can't reply back, and I go on swallowing, and if I cannot let go the steam, it will start working on the stomach and then start eroding the stomach, is a very common statement that we say. And recently people are saying, and people are able to identify a germ called H. pylori, which can be a triggering factor. It is not just a H. pylori infection. In fact, 30 to 40% of the society do harness H. pylori in the stomach, but if you are vulnerable, if you make yourself vulnerable and there is strong family tendency, a stress, it can get triggered off, and H. pylori has to be handled nowadays. Alcohol, chilies, steroids, painkillers or other causative agents that cause this. Here I would very much like you to understand the relationship between the stress, how it starts working on the stomach. The limbic cortex, the topmost portion of the emotional part of the brain, sends away information. If whenever I am agitated, stressed, anxious, frustrated, the suppressed tensions and worries, it sends down impulses to the hypothalamus, from where it triggers off impulses down both the parasympathetic and the sympathetic. When the information increased, extremely speeded up, hyperactive, oversensitive information, too many impulses going down the parasympathetic, it can work directly on the vagus and increase the acid production in the stomach, or also produce another chemical from the stomach itself called gastrin, which increases the acid. And on the other channel also, if there is too much information going down, it will constrict the blood vessels in the lining of the stomach and makes the healing and the repairing slower, and the protection is removed, and therefore both together causes this problem of fighting that goes on in the lining of the stomach, as if the lining is now being eaten away by the acid and the pepsin and the H. pylori together, which work on it.
Looks like stress is the main factor which triggers off the serious problem of acid peptic disease. We have heard so much about irritable bowel syndrome. Could you tell us something about it, please?
Yeah, even here people with irritable bowel syndrome, the incidence is going on increasing, and the common complaints of irritable bowel syndrome occurs in middle aged people. Women suffer more than men, and they complain of alternate diarrhea and constipation, and this typical complaint that these people have, the feeling of incomplete evacuation, although it is a formed stool. In fact, I am reminded of a person who had to sit on the toilet seat for almost 4 hours, and because of that he lost his job in the Navy, because he just would not feel that he had a clear bowel movement. The typical personality type that has been described for people with irritable bowel syndrome is they are very hyperreactive, extremely clean, they are always almost obsessively clean people, and nervous tendency, and very introspective, and they seem to have developed an extreme fixation on the bowel. The entire nervous system sending down impulses saying that I am not empty, I am not clean, I am not clean, I am not empty seems to be the sort of fixation that has happened, and they have an enormous concentration. The mind is always thinking of the bowel and bowel and bowel, and I see large number of people with this type of fixation. This irritable bowel syndrome or functional bowel disorder therefore is a condition where the problem is in the bowel, but lot of work has shown that this is an error of the propulsion. The intestine, the large intestine, which is basically the almost the last portion where all the digestion having happened, the food material that we eat enters into the large intestine, where only the water has to be reabsorbed, and while it is passing through the channel, it has to be pushed systematically, and it takes some time for the food material to reach the end portion, the rectum. If this movement of the contents is slow, then they end up with constipation. If it is too rapid, they end up with diarrhea. The movement of the intestine is again controlled by our nerves, the autonomic nerves, and the autonomic nervous system, which begins from the hypothalamus, the nervous system goes down, the parasympathetic nerves control these muscles, and they give us the sensation of emptying. And if this parasympathetic nerve that keeps on taking the information to the brain that look, now there is fullness in the rectum and then you have to empty, the information goes and comes, goes and comes, goes and comes, then this parasympathetic nerve hyperreactivity makes the person feel that it is not yet empty. After he has emptied the contents, the nerves simply keep on sending information and irritation and irritation, and therefore this feeling of incomplete emptying. So where is the problem? It is not in the bowel itself, but it is the nerves that sense that there is something sitting there and want to empty and empty and empty, and this is the overreactivity of the parasympathetic nervous system that causes this. And If it is the parasympathetic hyperreactivity, it causes extreme emptying and frequent emptying, the sensation of incomplete emptying. If it is the sympathetic, then they have constipation, but both are overreactivity, and you can see how this is controlled by our hypothalamus, and the emotions play an important role, very similar to the other end, gastric end and the emptying end. So, both the ends are controlled by our nervous system and our mind, and therefore, tackling the mind is a very, very important factor in the management. And bowel motility disorder is the erratic emptying of the bowel, and this imbalance is what we have to set right when we have to handle these patients. There is yet another condition called ulcerative colitis or inflammatory bowel disorder, which is also a very, very common psychosomatic problem, but much more serious than irritable bowel syndrome. In fact, if left alone, it can lead to cancer and perforations and even kill a person, but root cause again is in the mind. It is again an autoimmune disorder where the fighting goes on inside the large intestine because our white blood cells think that the inner lining, the coating cells of the large intestine are foreign, lose the capacity to differentiate self from non-self and start fighting against the lining of the cell, eat away the lining, and they start bleeding and bleeding. They have diarrhea with blood and mucus, etc. And lot of work has shown that these lymphatic cells, which are coming both from the lymph nodes as well as from the thymus, are the ones which are involved in this autoimmunity, and this fighting is controlled also by our nervous system. The limbic system sends down impulses down the lymphatics and starts creating this fight inside. If it happens in the stomach, it can lead to chronic gastritis. If it happens in the large intestine, it can lead to ulcerative colitis. Again, stress through immune system. If it happens through directly the nervous system, it is irritable bowel syndrome. If it happens via the immune system and causes a fighting and damage and ulceration, it is ulcerative colitis. Thus, what should be the right answer to this problem? Where should we really hit the problem? At the root cause, which is really the mind. The mastery over the mind is to be achieved through rest to the mind, deep, deep, deep rest to your nervous system, very deep rest to your brain cells, and that leads to rest to our immune cells. Then this higher faculty of differentiating the self from non-self is to be restored.
Many of my friends are suffering from digestive problems. They keep swallowing tablets one after another. Doctor said it's psychosomatic disorder, and I can see our lifestyle is full of stress. Is there any solution for this with yoga?
Let us see what yoga has to tell us about this stress and how stress results in these type of stomach problems. Our body is considered as having 5 aspects of our personality. The subtlest aspect is the Anandamaya Kosha, where the person is said to be in total bliss, harmony, freedom and mastery. The Vijnanamaya Kosha is the second aspect of our personality, which is quite subtle, which is the base of all knowledge and perfect health. And Manomaya Kosha is the aspect of our personality where all our likes, dislikes, stresses, anxieties, worries begin, and that is where we get stuck up in our emotional stresses and tensions. Pranamaya Kosha is the aspect of our life energy principle that helps each and every cell to be kept alive and healthy. If every cell in our body, the Annamaya Kosha, is getting its right quota of the prana, then the health of the organ will be very good. If the pranic flow to the organ is disturbed because of the basic root disturbance that happens at the Manomaya Kosha level, then it can result in problems in that particular organ. Therefore, when we start working with yoga therapy, we work at all these levels, and at the Anandamaya Kosha, the techniques are called karma yoga techniques or action in relaxation, where one is taught how to work by getting the hang of that expansion, relaxation, and learn to remain in bliss all the time. At the Vijnanamaya Kosha, yoga asks us to ask very basic questions about our concept of life, what is the purpose of my life, what is the goals in my life, search for truth, and what is really that I am looking for is happiness, and what is happiness, what is it that you are when you are happy, are the questions that are tackled. And when we talk to our patients, what I do is we go into the life situations of the person, what are the stressful life events that the person has gone through, what are the tensions that he is having to cope with in life, what are the demanding situation, how he is coping, what are his mechanisms that he is using, and what are the suggestions that the yogis, the Bhagavad Gita, the sages had given us could make a very big contribution, and people realize that my God, all the rush and speed was for achieving something that I wanted to achieve, which I thought will give me happiness, but when I am in that state of happiness, it is nothing but a state of my own mind, and therefore starting to work with my mind is the technique that I should be using. And working at this mind level, one goes on to move from the chanchala mind, the distractible mind, to a focused mind, and then go on to slowing down. Mind which is very highly speeded up, distracted and wandering hither and thither is now brought to an intense focus at a particular point of chanting Om, 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 and then slow down, slow down, slow down, quieten down, and then this is the whole technique of moving from dharana to dhyana. And we teach them, when you have a lot of pain in the stomach, when you feel extremely jealous in your mind, it focuses as intense pranic blockage in your stomach region, and you have to learn how to replace that jealousy by appreciation and acceptance, and also start diffusing these pranic blocks from the navel region, and that is how they start working at their Manomaya Kosha and learn how to reduce the speed of the mind. And cyclic meditation is a wonderful technique to reach this deep calmness of mind. Om meditation is the other one. At the Manomaya Kosha, the other very important practice is the concept of Bhakti Yoga, where the person learns how to reduce stress by remaining in a divine mood. In fact, Bhakti generally people tend to think is believing in some God who is sitting in the heavens and then offering something, pray to him and ask for favors. That is not really what real bhakti is. Narada, who is a pioneer in this concept, Narada Bhakti Sutra, says bhakti is nothing but parama prema rupa. Just like every one of us have experienced, including animals, birds, experience this feeling of lot of inner peace and joy when you are in the presence of your beloved, like the mother and the child. And this experience that we all have experienced should be enlarged to the universe around me, and recognize that this is helping you to touch the deep inner mood, and for that devotion and surrender to a higher force is recommended, and that is how Bhakti Yoga helps, and helps us to move from this nature of ours which we have learned through our education, the complaining nature from which we move on through tolerance, acceptance, to surrender and appreciation, where we can start living a more harmonious life in our society. The type of stresses that could cause these type of problems could all be handled by this type of multidimensional approach in yoga. The cravings and habits are the ones which are the real problem at the mind level, and we have seen that alcohol and smoking are the major triggers for this problem, for which what really needs to be done is the willpower and the confidence. Therefore, we should start training them how to learn to develop this willpower and confidence.
Does this concept really work? Have you seen smokers stopping smoking, alcoholics coming off alcohol, etc.?
Yes, in fact, let me share this concept with you. Once I had a telephone call from a doctor friend of mine who started doing yoga for his general health, and he was slightly diabetic. After about 15 days of his practicing, he, in the middle of his busy clinic, he calls me. I was also in a busy clinic. He calls me back and says, "Doctor, I know that you are very busy in your clinic, but I just realized something I just want to share with you." I said, "What is it?" Then he said, "Madam, I was such a chronic smoker. In the last 10 days, I have stopped smoking, and I did not even know that I had stopped smoking, and I just realized now that today, in the last 10 days, I never felt like smoking." It seems to be that it is a naturally calming process which takes you away from the urge to smoke, and that is how this natural replacement of the urges by slowing down is a very, very important thing to help you to move on to deeper layers of your personality. So, many techniques are used by smokers. They say one last puff and no more in the name of the beloved, name of the Lord, or pray for the thing, or replacement by chewing gums, etc. Whereas, we recommend that whenever you feel like smoking, you just do Sheetali Seethkari Pranayama, as if you are making a tube of a smoke. Allow the smoke of the coolness to go in and get out of this problem. Working at the Manomaya Kosha, we have understood. Working at the Pranamaya Kosha, the pranic imbalances have to be set right, and in the case of gastritis, this imbalance is in the Samana zone of the prana, wherein we have to start helping them to balance this prana in this region, for which the first thing we say is, please avoid forward bending practices in the sitting position, which tends to increase these blockages here, and the general aches and pains that are experienced can be relieved by many other asanas in this condition. In irritable bowel syndrome, the imbalance is in the form of excessive apana. Therefore, they have that continuous urge to empty the bowel, and therefore, we use a lot of the inverted postures. Here, the balance is to be achieved by the left and right balance also. The Surya Anuloma Viloma Pranayama, the right nostril breathing, which helps us to balance the right half of the body, and the Chandra Anuloma Viloma Pranayama, which helps us to balance the left half of the body, are the ones which are very usefully used in Nadi Shuddhi, cleansing of all the nadis, and that stabilizes our samana. And in our research, we found that practice of 12 rounds of Nadi Shuddhi 4 times a day brings about this balance of prana, and we recommend this to all our patients with the GID. Again, a few points about what are the asanas one should not be doing, one should be doing, what could aggravate the pain in acid peptic disease. As I said, the forward bending in sitting postures may aggravate the pain, and which may be because it blocks the prana in the samana region. We emphasize standing postures in these people, and also emphasize back bending and deep relaxation technique. Kriyas in APD. I met a doctor who said, "My God, Vamana Dhauti, already stomach is full of acid. If you make them vomit, won't all that acid come back and burn away the esophagus?" No, this technique must be really bad for people with hyperacidity. Was a big question which a technical professor was asking me. Yes, it sounds like that, but what yoga teaches in these kriyas is mastery over these reflexes. The first of all, in Vaman Dhauti, we are not going to make them bring out the frank acid as it is. We make them drink lot of saline water, dilute the acid, and the diluted water is the one which comes out. Therefore, certainly it is harmless. In fact, it is soothing. But more important than just removing the acid, what is important is the mastery over that acid producing reflex, reverse reflux reflex, and the vomiting reflex. Other practices in the kriyas that are useful are the Uddiyana Bandha, Nauli Kriya and Agnisara Kriya, all of which help to improve the blood flow to the internal organs and help in bringing about this harmony and balance. Particularly in people with irritable bowel syndrome, during episodes, please avoid any of these vigorous practices like dynamic standing postures and emphasize inverted posture. During IBS, emphasize on inverted postures like Sarvangasana, Matsyasana, Halasana, etc. Viparita Karani practice with wall support with deep abdominal breathing and chanting of Akara and Ashwini Mudra in this particular posture is very useful, and we have been finding this extremely beneficial in large number of patients in our hospital here, where we have been teaching this to good number of people with acid peptic disease, various types of digestive disorders, constipation, diarrhea, ulcerative colitis. I am reminded of a lady who had ulcerative colitis, was on heavy doses of steroids, and now it is almost 10 years. She has never had even a single episode of bloody diarrhea, which is a big problem in ulcerative colitis patients. Many patients have been saved from the need to go in for surgery. Thus, yoga says that you should learn how to slow down, expand your personality, learn to accept the people around you, and this is the real basis, which is a holistic approach, a total approach. And Swami Vivekananda said this in this simple one single sentence, that to surrender is not a weakness, but it is expansion of your personality. It is the basis of yoga therapy, and many people have benefited from this.
It is very much within a person to cure this disease, and if one can get that confidence, I think it goes a long way. Thank you very much, Dr. Nagaratna.
Thank you.
Let us now move on to the systematic practice of yoga, a step-by-step guide to your practice at home.